Hello students, welcome to the channel. Now let us discuss about otic ganglion. So otic ganglion is a small ganglion. It is not a large ganglion, it is a very small ganglion. It measures up to around 2 to 3 millimeters. That is why it is a small ganglion. Now what does it do? So it relays secretomotor fibers to a gland, and the gland is nothing but the parotid gland. So it is parasympathetic in nature, and it is very closely associated with the mandibular nerve, and functionally it is related to the glossopharyngeal nerve. Now let us discuss about the size and situation of the otic ganglion. As we have already discussed, it is a very small ganglion measuring up to 2 to 3 millimeters only. Now the location. So it is located in the infratemporal fossa. What is infratemporal fossa? It is a cavity in the skull. So it is a fossa. So the otic ganglion is located in this infratemporal fossa, and it is located exactly below the foramen ovale. It actually passes through the foramen ovale. They can ask you what are the structures passing through the foramen ovale. So otic ganglion is one of the structures passing through the foramen ovale. Now it is located medial to the mandibular nerve and lateral to the tensor veli palatine. Now let us discuss about the connections of the otic ganglion. It has primarily three roots, which are the parasympathetic root, sympathetic root, and the sensory root. So the parasympathetic root and the sensory root are predominantly formed by nerves, but then the sympathetic root is formed by an artery. This you have to remember. The parasympathetic root is formed by the lesser petrosal nerve. Now let us discuss about the course of this parasympathetic root. Now from the inferior salivatory nucleus, preganglionic fibers will arise, and they relate to the nerve number 9, which gives off a tympanic branch which forms a tympanic plexus. And from this tympanic plexus there forms a nerve which is the lesser petrosal nerve, and we already discussed from the parasympathetic root, from the lesser petrosal nerve, otic ganglion is arising, the parasympathetic root mainly. So from this parasympathetic root of otic ganglion, postganglionic fibers are arising, and these join together with one more nerve, which is the auriculotemporal nerve. With what nerve? With the auriculotemporal nerve, postganglionic fibers are of otic ganglion are joining, and they relate to the gland, which is the parotid gland. So this is all about the parasympathetic root. Now coming to the sympathetic root, we already discussed it is different from parasympathetic root and sensory root. Why? Because these two roots are arising from nerves, but then the sympathetic root is arising from an artery. So the artery is middle meningeal artery. And what is the function? So it has vasomotor function. The sympathetic root of otic ganglion has vasomotor function. Now coming to the sensory root, the name itself tells you that it is sensory. So it is sensory to parotid gland. So it is arising from the auriculotemporal nerve. Now let us discuss about the clinical significance of the otic ganglion. So we already discussed that the otic ganglion is actually related to the auriculotemporal nerve, right? So if any damage to this auriculotemporal nerve occurs, there arises a syndrome which is called as the Fraze syndrome. This is a very unique disease, because it causes sweating, but then it is not normal sweating. It is salivation induced sweating. When does the salivation is induced in the body? When we are having some meals. So at that time sweating occurs, especially near the ear region. So this is called the phrase syndrome, which is nothing but the salivation induced sweating. That means whenever the salivation is taking place, the sweating is taking place simultaneously, and it is occurring due to the damage of the auriculotemporal nerve. Now that is all about otic ganglion. Let us discuss an MCQ related to otic ganglion. So the question is, parasympathetic root of otic ganglion is derived from, and the options: greater petrosal nerve, lesser petrosal nerve, caudate tympanic. So we all know the answer. The answer is the lesser petrosal nerve. Thank you for watching this video. Please do subscribe for more videos.